Diagnostics is now an integral part of healthcare. It's the vision of Honorable Chief Minister of Telangana, Shri Kalvakuntla Chandrasekhar Rao Garu, to ensure comprehensive diagnostic services to the people. Telangana Diagnostics, which is a hub and spoke model of providing diagnostic services to the people in the state under the brand name T Diagnostics, was his brainchild.
ఈ టీ డయాగ్నోస్టిక్ సెంటర్ ఏంటంటే 57 రకాల రక్త పరీక్షలు ఉచితంగా అందించడం కోసం ఇవాళ టీ డయాగ్నోస్టిక్ సెంటర్ వచ్చింది. సో ఇంటింటికి వెళ్ళి వాళ్ళ బ్లడ్ శాంపిల్స్, మూత్ర పరీక్షలు, వాళ్ళ బీపీ, షుగర్, అన్ని రకాల పరీక్షల్ని కూడా చేసి వాళ్ళకు ఒక డిజిటల్ హెల్త్ కార్డ్ అనేటువంటిది ఇవ్వడం జరుగుతుంది. ఇవాళ తెలంగాణ ప్రభుత్వం గౌరవ ముఖ్యమంత్రి కేసీఆర్ గారి ఆలోచనలు ప్రతిదీ కూడా దేశానికి ఆదర్శంగా ఉంది.
T Diagnostics been recognized by Ministry of Health, Government of India as a best practice in the year 2021.
Has given an overall ranking for Telangana state is number 3 in the country. Health law, we are number 3 in the country. Except Tamil Nadu and Kerala, we stood number 3 overall ranking in health.
As a new state, Telangana had the opportunity to take a fresh look into the healthcare needs of its 4 crore population. Research shows that on an average, every person spent 1,800 rupees per annum as out-of-pocket health expenditure. Of this, 70% to 80% is spent on drugs and diagnostics. At this juncture, as a transformative reformation, a completely in-house model of T Diagnostics has been established. In the year 2018, a pilot project was launched in Greater Hyderabad Municipal Corporation on a hub and spoke model with 36 collection points as spokes and a central hub. Spokes gradually increased to 350 numbers to cover whole GHMC area. Subsequently, over a period of 2 years, in all districts, every primary, secondary and tertiary care hospitals and health and wellness centers has been transformed into a spoke and attached to nearest diagnostic hub, which is located in the district hospital premises. Any person requiring health support can walk into any of the government operated hospital, health center or Basti Davakhana or wellness centers and get free doctor consultation. The doctor will prescribe the required diagnostics and test samples are taken on the spot. Within a maximum of 24 hours, the patient will receive message on his or her mobile with test results.
మాకు ఆర్థికంగా కూడా చాలా మేము బాగా ఇబ్బందులు పడేవాళ్ళం మేము. కానీ ఇప్పుడు ఒక టెస్ట్ ఇక్కడ మన తెలంగాణ డయాగ్నోస్టిక్కి వచ్చేసరికి ఒక టెస్ట్ రాస్తే మా 2-3 టెస్టులు ఫ్రీ ఉచితంగానే చేస్తున్నారు. ఇది మాకు చాలా ఆనందకరమైన విషయం అండి, చాలా సంతోషం ఇది.
जब से यहाँ दवाखाना पड़ा, यहाँ से आके ले रही हूँ, मेरे को फायदा हो रहा. हड्डियों में पैरों में दर्द हो रहा, जब भी आ रही हूँ गोलियाँ ले जा रही हूँ, कम हो रहा. अच्छी गोलियाँ दे रहे हैं, अच्छे ट्रीटमेंट.
However, all this would not have been possible without putting in place a very resilient structure that qualifies all international standards and be modular to facilitate expansion to accommodate continually growing volumes. So let's have a look at what goes on from the time a sample is taken for the test to the time the phone pings with the results. Doctor prescribes a diagnostic test and the details are directly entered into the app. Step 1. A trained phlebotomist in the same facility takes the sample and instead of re-entering patient's details, a barcode from the software is pasted onto the sample to ensure unique ID. Step 2. Samples are put in a temperature-controlled box which is sealed and a common barcode is pasted on it. Taking into account the TAT, a dedicated transport vehicle transports these samples to the hubs. Step 3. At the hub, the diagnostics team scans all barcodes on the boxes and sends for quality check. Step 4. The samples cleared by quality check are sent for further processing. The hub is equipped with fully automated machines that not only do the test on the sample without any human intervention, but also upload the results directly through the bidirectional software and link it to the patient database based on the barcode. Step 5. This data is then verified by experienced specialists who then digitally approve through the highly advanced multi-directional software. Step 6. The software then automatically sends the results to the patients through SMS. Depending on the test results, the doctor takes necessary action. The patient also has the option to get print reports.
మేము టెస్టులు చేయించుకున్నామంటే మాకు సెల్లుకి మెసేజ్ సాయంత్రం కల్లా వచ్చేస్తుంది, డాక్టర్ గారు కూడా ఫార్వర్డ్ అవుతుంది.
Highest quality is maintained at every step of the process. The Health Department of Telangana has entered into an MOU with AIIMS Delhi and CMS Velo for EQUAS or External Quality Assurance Scheme. The average accuracy is 99.9%, which is way beyond accepted international standards. Diagnostics has completed the NABL pre-assessment for the hub and spokes in Hyderabad and is expecting accreditation by the month end. Soon all the district hubs will also apply for entry-level NABL certification. For radiology-based tests, mini hubs have been established so that patients can get tests like ultrasound, ECG, CT scan and X-ray without having to travel far or having to spend time at a big hospital. When a radiology test is required, an appointment is created by the doctor at the nearest mini hub. At the appointed time, the patient can visit the designated mini hub and get the test done. Reports are given in a professional jacket, ensuring long life of the reports.
अब जाते शेर पे దకాలు ఖర్చు ఉన్నారు దాని దకాలు
ఇక్కడ ఈ చిన్న ఈ హాస్పిటల్లో ఇక్కడ మాకు అన్ని రకాల టెస్టులు చేస్తున్నారు, 57 రకాల టెస్టులు చేస్తున్నారు.
This entire process has a dedicated team working 24/7 in 3 shifts and is backed by extremely advanced technology. Now, people are getting diagnostics close to their home. False alarms and hits in diseases are both identified early and complications of diseases can be avoided. Finally, patients are benefited by not losing working days, relieved by waiting period at secondary and tertiary care hospital, reduced out-of-pocket expenditure, timely treatment.
ఏమో మనీ గన్నీ మాకు ఖర్చు కలిసి వచ్చింది, రేపు ఖర్చు లేకుండా అంతా ఆరోగ్యంగా మంచిగా ఉన్నాం.
ఖమ్మం పోయి మేము పరీక్షలు చేయించుకోవటం అక్కడ రోజుల్లో పట్టేది మాకు.
For secondary and tertiary care hospitals, the patient load is reduced, hence quality of treatment is increased and reduced disease burden for government. Diagnostics started with 57 tests and is in the process of being increased to 134 tests as per Free Diagnostic Services guidelines. So far, 20 lakh patients benefited by Diagnostic Services by processing over 3 crore tests, saving over 175 crores out-of-pocket expenditure of poor patients.
57 రకాల టెస్టులు అందుబాటులో ఉన్నాయి కాబట్టి మేము ఇక్కడే చేయించుకుంటున్నాం. బయటికి వెళ్తే ఒక టెస్టుకు 4 టెస్టులు రాస్తున్నారండి. దీనివల్ల మాకు 3000 నుంచి 5000 అవుతున్నాయి.
During pandemic period, Diagnostics provided free COVID-related blood tests costing 4,000 to 8,000 rupees, completely free of cost. TB samples are also being transported through Diagnostics vehicles to ensure maximum utilization of infrastructure. Recent viral hepatitis screening campaign, where more than 50,000 people have been screened, the diagnostic have been used for testing the samples. Telangana state is continually upgrading Diagnostics to cover all diagnostic services and will continue to be among its top priorities till it covers every major test for everyone across the state.